rodents. So when you stimulate them with 1 and 5 hertz, is it slowing activation? Because we know 1 or 5 hertz is a little bit slowing compared to 10 hertz, which is more activating, at least what we use in TMS. Why is the choice between 1 and 5 hertz for stimulation rodents?
So you are at Rutgers.
Yes.
Jesus Christ, where? How come we didn't meet? You are in New Brunswick. I am in.
Then they are overlaid onto the EM. Yeah, so this data set provides several lines of new insight.
So first, I'd like to begin with Dr. Prasad will give his online speech. He's the first speaker. And again, Dr. Prasad is the Chief Scientific Officer. A round of applause. I thought it was excellent. The food, the service, everything. It was really good. You guys did a great job. And I thought it was really good. You know, it's pretty memorable for me. So the title of my presentation is, Will the recent regulatory approvals of the new disease-modifying treatments, some of which Dr. Prasad just mentioned,
PTSD?
Right. So the question is basically, would it be useful to try to prevent post-stroke depression? And I think there's some evidence that duloxetine in particular is useful in preventing stroke post-stroke depression. At a year or 2 years or 3 years, this sort of neglect, because we're taught that that is something that spontaneously improves fairly rapidly in most patients. Are we missing it?
Thank you very much for the question. Yes, we have patients, and after 2 weeks after stroke.
How is the referral written? You're saying here that you sort of can focus on ruling out certain sort of acute conditions. Can you comment, elaborate a bit on that?
Yes, thanks for the question. So portable MRI, in my opinion, should not be called an MRI. It should be called its own modality because it's different than what we think a conventional MRI does, and is different than a CT scanner, and it's obviously different than ultrasound.